Alright, so we're going to look into my three different diagnoses. Right? Delusionary disorder, previously called paranoid disorder, is a type of serious mental illness called a psychosis, in which a person cannot tell what is real from what is imagined. This is unlike people with other psychotic disorders who might have delusions as the symptoms of their disorder. What are grandiose delusions? A delusion of grandeur is the fixed false belief that one possesses superior qualities such as genius, fame, omnipotence, or wealth. It is most often a symptom of schizophrenia, but can also be symptoms found in psychotic or bipolar disorders, as well as dementia such as Alzheimer's. Delusions of grandeur, also called grandiose delusions, often accompany other mental health symptoms, including other delusions that may relate to mental or physical health conditions, including schizophrenia, bipolar disorder, or some other type of dementia. Alright. What are signs, what are the symptoms of delusionary disorder? Non-bizarre delusions. These are the most obvious symptoms: irritable, angry, or low mood. Hallucinations, sometimes hearing or feeling things that aren't really there, related to the delusion. For example, someone who believes they have an odor problem might smell a bad odor. Mm-hmm. What type are the different types of delusions? There are several subtypes of delusionary disorder, and some of these include persecutory delusion, delusion of grandeur, delusional jealousy, erotomania, or delusions of love, somatic delusional disorder, induced delusional disorder, or folie ado. Well, do is two. Mm-hmm. And folie must mean something in French, right? Alright. Now, I only claim to be a prophet because I had a dream. I saw a throne with a bright light shining from it. And not until 93, after getting involved with Christian Fellowship Church from June of 90. Mm-hmm. Alright, there's different types of bipolarism too, right? There's one, two, mix, cyclothymic, and more, right? A disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Mm. And this is from WebMD, right? And I'm quoting their diagnosis of this particular illness. So, there are several types of bipolar disorder, all involving episodes of depression and mania to a degree. Bipolar disorder is a lifelong illness. Episodes of mania and depressions eventually can occur again if you don't get treatment. Many people sometimes continue to have symptoms even after getting treatment for their bipolar disorder. Here are the types of bipolar disorder. Bipolar 1 disorder involves periods of severe mood swings, severe mood episodes from mania to depression. Bipolar 2 disorder is a milder form of mood elevation involving milder episodes of hypermania that alternate with periods of severe depression. Cyclothymic disorder describes brief periods of hypermania symptoms alternating with brief periods of depression, symptoms that are not as extensive as or as long lasting as seen in full hypermania maniac episodes or full depression. Mixed features refers to the occurrence of simultaneous symptoms of opposite mood polarities during manic, hypermanic, or depressive episodes. It's marked by high energy, sleeplessness, and racing thoughts. At the same time, the person may feel hopeless, despairing, irritable, and suicidal. Rapid cycling is a term that describes having 4 or more mood episodes within a 12-month period. Episodes must last from some minor number of days in order to be considered distinct episodes. Some people also experience changes in polarity from high to low or vice versa within a single week or even within a single day, meaning that the full symptom profile that defines distinct separate episodes may not be present. For example, the person may not have a decreased need for sleep. Right? I've been through all that. Sometimes called ultra-rapid cycling, there is debate within psychiatry as to whether this phenomenon is a valid or well-established feature in bipolar disorder. A pattern of rapid cycling can occur at any time in the course of illness, although some researchers believe that it may be more common at later points in the lifetime duration of illness. Women appear more likely than men to have rapid cycling. A rapid cycling pattern increases risk for severe depression and suicide attempts. Antidepressants may sometimes be associated with triggering or prolonging periods of rapid cycling. However, that theory is controversial and still being studied. So, I want to print this out because I'm going to present it to the judge in my case, right? See, I'm trying to figure out which one I have, right? Or maybe you don't even have, right? Now the problem is, Dr. Weinreb said I'm psychologically fit for naval duty, right? Before I left Great Lakes, right? And she saw no symptoms of psychosis nor schizophrenia when I saw her, right? You can't do all that. No, you can't. You gotta prove it beyond all reasonable doubt. You can't do that, and you can't do that, right? But she saw me at least weekly for 3 months, right? In what you call an hour session, right? That's not a short amount of time to not get to know the patient, right? Either. And make sure he had no other psychosis or symptoms, right? But you're playing doctor and you're letting them play doctor if you let their diagnosis stand and not the truth and not the truth. Being a Christian, okay, some do sometimes think they're a prophet, right? Now, I'm basing mine on a dream, right? Not saying, right? Well, that's the point, right? Mm-hmm. Mm-hmm. We're not proving it beyond our reasonable doubt. No, we're not. Or should you explain why the child wouldn't go in there to him unless you're trying to set him up with the child, right? Which then is on you, and mm-hmm. Mm-hmm. But I have 3 different opinions, doctor, and judge, and we gotta determine which one it really is. And, you know, I hate to put you on the spot, but, uh, problem I'm facing. Sorry, sir, sorry, sir. And Mrs. Sir, Mrs. Sir. So schizophrenia is the most type. Paranoid schizophrenia is the most common type of schizophrenia. Schizophrenia is defined as a chronic mental disorder in which a person loses touch with reality. Psychosis. This helps to differentiate schizophrenia from other mental disorders, such as bipolar disorder. What were your first signs of schizophrenia? If someone experiences any of the following for at least 6 months, they might be diagnosed as schizophrenia. Positive symptoms. Hallucinations and delusions are two common positive symptoms of schizophrenia. Negative symptoms. These signs may be confused with symptoms of depression. Cognitive symptoms, which means you're not aware of who you are or where you're at. Right? Symptoms such as hallucinations and delusions usually start between the ages of 16 and 30. Men tend to experience symptoms earlier than women. Most of the time, people do not get schizophrenia after age 45. Schizophrenia rarely occurs in children, but awareness of childhood onset schizophrenia is increasing. What are the 5 types of schizophrenia? Paranoid schizophrenia, disorganized or hebephrenic schizophrenia, catatonic schizophrenia, childhood schizophrenia, schizoaffective disorder. What is the main cause of schizophrenia? The exact causes of schizophrenia are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop the condition, right? But you do develop it, right? Some people may be prone to schizophrenia, and a stressful or emotional life event might trigger a psychotic episode, like your new shipmate getting electrocuted. Yeah. That might would do that. No, I wouldn't do that. And them not training you to be an electrician afterwards. Now, when you quote someone, you're agreeing with their findings in this particular subject too, right? But usually you're not coherent or conjugative, right? With schizophrenia either. I'm fully cognizant during the day. I don't lose sense of reality, right? That's your problem there, right? I might agree with more the bipolar, because I do have times during the day, like I said, when my disability don't bother me, like in the early mornings, right? Especially the physical one, right? But then I have episodes where I have to rest, things like that, right? Well, that's not normal with my injury, right? Alright, schizoaffective disorder. Mm-hmm. But still, each one is less or different in severity, right? Mania, depression, poor appetite, weight loss or gain, changes in sleep pattern, sleeping very little or a lot, agitation, being very restless, lack of energy, loss of interest in usual activities, feeling of worthlessness or hopelessness. Right? Well, unfortunately, I have to determine that first and sue Dr. Scholler for the Vilify, right? Mm-hmm. I think he would be the best one to go after first, right? Yeah, so very informed, sort of a thing. So this lasts less than 6 months, but obviously they've been thinking I'm schizophrenic for 25 years, right? Or more. In October it'll be 26. Hallucinations, seeing, hearing voices, right? Is seeing, hearing, or feeling things that aren't really there, aren't real. Now the thing is, I think, kind of like with schizophrenia, all the voice told me that I first heard was Jerusalem, Jerusalem, Jerusalem. Or she's your witness, meaning she, I know. Things like that, right? Nothing really detrimental or negative either. Now, I'm not saying I don't have the normal temptations we all have, like um, how to get money and maybe I should rob a house, or things like that that I was exposed to growing up as well. I know, especially through my stepbrother Mark. Right. Well, he kind of talked me into burglarizing the house after my car